It was supposed to be just for rehab, just to get him a little bit stronger, and then he was supposed to go home. And that never happened.
It's a 2.5-hour drive. It was 110 miles from one side of the island to the other. He was put in a situation that would result in danger.
That's absolutely horrifying. It's just a horrifying story.
And I asked the nurse, I said, can you take the mask off? So I can at least see her smile or see what she's trying to say, but they would do it.
The only solution to this are policies that keep COVID out of the general community.
Nursing homes all across the country are fighting behind closed doors. Since the pandemic began, nursing homes have struggled with keeping residents safe. Some even call it a helpless fight. InvestigateTV spent most of this year examining the programs designed to keep our most vulnerable citizens safe, people who often cannot speak or fight for themselves. We found that programs run by the Centers for Medicare and Medicaid Services are falling short, failing to help facilities with serious, even deadly problems. Now we look into what has gone wrong, from uncovering hundreds of inspection reports to sharing final moments with loved ones. I'm Lee Zurich, and this is Helpless, Patients at Risk. We are recording on our end. We're ready. So tell me a little bit about your father. What was he like?
My dad's name was Charles Them. Very outgoing. He was a very good storyteller. Loved the beach. Loved California. Raised 6 kids. Me and my mom. Very religious. He loved his family. The condition that he was in was unimaginable.
Beth Them says her father's condition changed because of a short stay at a nursing home. After a fall in the bathroom, Charles Them spent 2 weeks in the hospital. Before going home, doctors suggested rehab to get stronger. The family checked him into an Iowa nursing home, Touchstone Healthcare Community. When Beth Them called to check on her father, she says the home gave her few answers.
The phone would ring off the hook, and then they would pick up the phone, hang up the phone, and then we would call right back, and then they would finally answer. And they would give us a runaround. Oh, he's sleeping. I'm not over in that unit right now. Oh, I'm not his nurse.
After about 1 month here, he had to be taken by ambulance to hospice care.
They would not take him as is because he was sitting in a filthy diaper. So they made Touchstone clean him before he left the facility.
Touchstone left him in a dirty diaper?
Yes.
And tried to send him away in that dirty diaper?
Correct, and we don't know how long he had been in that diaper.
Charles Them died 2 months shy of his 78th birthday. Do you think he would still be alive right now if he would have been somewhere else and not there?
Absolutely. Because he was thriving at the hospital.
Touchstone Healthcare Community is on a nursing home list reserved for as many as the 88 worst facilities in the country, what's called the Special Focus Facility Program. In 1987, Congress designed the Special Focus Facility Program to provide additional oversight and penalties for nursing homes with a persistent record of poor care for at least 3 years. Are nursing homes getting better because they're a part of this program?
No, I don't think the Special Focus Facility has achieved its goal.
Instead, federal records show problems persist at these homes. In the past 3 years, our analysis shows as of October, nearly 80 facilities in this program have more than 1,600 substantiated complaints. That's an average of more than 20 for each home. For example, last May, inspectors found a resident at a Butte, Montana nursing home aspirated food into his lungs and died when the staff failed to suction him. The federal government claims it takes homes about 18 months to come into compliance and move out of this program. But our analysis shows more than half of nursing homes currently on the list have remained in the program longer than 18 months.
If the facility is still a special facility program for a long time, it tells you that it has not, the program has not really achieved its goal. The facility is still providing poor care, very poor care, to a lot of residents.
Touchstone Nursing Home, where Beth Them's father spent a few weeks, has been in the program for 36 months. In that time, it's been fined 4 times for a total of $166,000. Since 2018, federal records show at least 3 other residents have died there because of poor care. One who died had been in a soiled diaper for several days.
These poor facilities are usually already underwater, underfunded, sometimes don't know exactly what they're doing. And what they don't need is more fines and more regulation. They need somebody to come in and help them.
The president of a nursing industry association agrees the program has good intentions, but is limited in its effectiveness because the government punishes homes with fines instead of working with them to be better.
The only way you get off the list is that you have to be incredibly good during the survey process. You get surveyed twice as often as a regular facility, and you have to do much better. Again, in principle, that's a good idea, but only if they're given the resources and the help to get better. And they're not given anything.
The program has more challenges. Funding from the federal government is limited. It's capped at 88 nursing homes, so many homes that deserve to be in the program can't get any extra oversight.
We would love to see a program where maybe the bottom 10% of facilities in the country, 1,500 facilities, 15 times the current number on the special focus list, were given special attention and special collaboration to get better. That would materially move the quality needle across the country.
Were you even aware that a list like that existed?
I don't think a list like that should exist.
Because they shouldn't be in business?
They shouldn't be in business. Absolutely not.
And you don't think this nursing home should be in business?
Not one bit.
And the program itself, it's one Beth Them would argue, didn't help improve her own father's care.
I don't know how another person could do that to someone else. I work in healthcare. I'm on the end of saving lives. I do that every day. And how someone can do that to another human being and treat them with no care, I have no words.
Touchstone was the only facility that responded to our requests for comment. Executive Director Timothy Cook said Touchstone has been making major progress to address problems found during inspections and that it continues to strive to elevate care of residents. The state of Iowa says Touchstone didn't provide adequate care for Charles Them during his time at the nursing home. Specifically, the state said staff did not maintain his oral hygiene, bathroom, or bathing requirements. Beth spoke with us again after she got that letter, which reminded her who was missing from a recent life event.
Because of them, my dad wasn't there. He didn't get to walk me down the aisle. I didn't get to have a daddy-daughter dance with him.
Started talking to the patient, and I noticed that his feet were in very bad condition and that he could not stand up to make a meal or take a shower or take care of himself.
Nursing homes that should be part of the Special Focus Facility Program, a program designed to make them better, can't be admitted. Some of the worst nursing homes in the country, hundreds of them, remain on a waiting list, sometimes for years.
I've been with Lyft for 3.2 years. I have more than 1,600 rides and currently have a 5.0 rating. It is the most memorable of the 1,600. I was uncomfortable with the position I was in.
That ride began at this nursing home in Hilo, Hawaii. Federal records show the home lined up Rex Riley's Lyft, withdrew money from a resident's bank account, and sent that elderly resident with dementia about 100 miles away, around a 2-hour drive to the Monago Hotel.
So do you know about this hotel we're going to? He says, I'm not going to a hotel, I'm going to go see family. He didn't know where he was going and didn't match what I was told.
But the nursing home reiterated to Riley the resident would be checking into the hotel.
They had put 2 boxes of his belongings and a wheelchair in the back of my car. It was 110 miles from one side of the island to the other, all the way over to the city called Captain Cook. By the time I got there, it was dark and it was raining.
But when he arrived at the Monago Hotel, staff there raised a question.
Does he have a credit card? And I says, well, I'm not sure. Let me wheel him over. And I brought him over and he said, no, I don't have a credit card. The hotel was setting up the arrangement.
The nursing home made a reservation for one night with no plans for payment. The patient had no identification, no money, no credit card, no medication. Those federal records show upon arrival, the hotel owner said the man was lethargic, unable to walk. One foot was purple. Riley has a background as a paramedic and a volunteer firefighter, so he knew help was needed. Riley and the hotel owner called the nursing home. They talked to a person once, but say after that, no one would answer.
Here I am, 110 miles from where I picked up the gentleman. The hotel won't take him. I won't leave him. And in my opinion, as a paramedic and respiratory therapist, he needs additional medical care.
This is just one of several violations inspectors found at the Hilo Rehabilitation and Nursing Center. Violations so serious, the home should be part of the Special Focus Facility program. But it's not. Instead, this home and nearly 450 others are essentially on a waiting list, candidates waiting to be part of the program that's supposed to provide extra oversight of nursing homes with years of persistent poor quality of care.
No, the government's not doing enough.
Last year, Pennsylvania Senator Bob Casey helped force the Centers for Medicare and Medicaid Services, or CMS, to release the waiting or candidate list. Before then, it had been private. The list reveals some nursing homes have been waiting to be a part of the Special Focus Facility program for as long as 6 years. The program only has room for up to 88 homes in the entire country. 29 states, including Louisiana, Kentucky, Virginia, and Arizona, are limited to one home in the program.
Does it make sense that a home can be on the candidate list for several years and never get into the program?
No, it doesn't. And the only reason why that's the case is a question of resources, that they can, in a sense, only put a limited amount. And presently, I think it's about 84 on the participant list, but they can only make that list of 84 be the subject of additional review and more frequent inspection and oversight, because that's the limit of the resources.
Casey says limited resources simply means not enough money is being allocated to the program to increase the number of eligible homes.
This is definitively affordable if your priorities are straight.
According to the federal government, a California nursing home was the worst of the worst. Residents at Bethel Lutheran Home have been subjected to seclusion, manhandling, and verbal abuse from staff members. On 2 separate occasions, one woman was confined to her room for several days for gifting a Bible and $2 to a facility custodian. Another woman had to stay in her room for more than a week because she was coughing, yet nursing staff never provided any medical treatment or tests. Over the past 3 years, Bethel Lutheran has had so many serious violations, it scores by far as one of the worst nursing homes in the country. Yet a lack of space prevents it from being in the Special Focus Facility program. It remains on the waiting list. But there's more. Many homes on the waiting list are being overlooked. Our analysis found more than 25% haven't been inspected in at least 16 months, which is much longer than any facility is supposed to go, even those with 5-star ratings.
These buildings are already underfunded. They already do not have the resources that they need. So if we just keep slapping on more fines and more fines and more fines, it doesn't make the buildings better. It makes the care worse, and that's worse for the resident.
Are these homes on the candidate list, are they in a way getting a free pass because they're not getting the extra oversight that the program has?
No, because the program isn't helpful. If the program was made helpful, then I think you could make the argument that we really ought to put these other buildings into the program.
That nursing home in Hilo, Hawaii helps show what some call the absurdity of the program. A few months ago, it was actually one of the 88 homes in the program. This summer, it graduated, moved out, but was instantly placed on the waiting list to move back in. Meantime, Rex Riley hasn't forgotten about that ride or that passenger.
So I know that he survived and was cared for after this incident.
A nursing home the federal government rates as one of the worst in the country can't even receive extra attention simply because the government hasn't prioritized the price of a resident's care over the cost to fully fund a program that's meant to ensure no other fragile patients are evicted into a lift.
They've endangered this man's situation. They put him in a car, drove him 110 miles, and expected me to drop him off, and that was the end of it.
Senator Casey says he'd like to inject $20 billion into nursing home oversight so these poor-performing facilities can receive extra scrutiny. Legacy Hilo and Bethel Lutheran did not respond to our requests for comment.
This kind of blood money, people suffered, abused, neglected, even died.
As nursing homes struggle to test employees and residents and protect them with PPE, we found a pool of money, hundreds of millions of dollars available, but the federal government won't empty the bank account. When the government fines nursing homes for putting residents' health and safety in jeopardy, that money goes to each state and is kept in what's called the Civil Money Penalty Fund.
This kind of blood money, this is money that is collected because people suffered, abused, neglected, even died.
The money is supposed to be used to protect residents or improve their quality of care or life. But according to our research in the American Healthcare Association, around $400 million of that money is unspent in state bank accounts across the country. Many states started the year with millions. We found Texas, Michigan, and Georgia had more than 20 million, South Carolina 16, Mississippi 14 million.
I think your reporting on this has been terrific, and we're going to utilize some of your data to hopefully convince CMS to direct this money more aggressively in useful ways, which right now would clearly be infection control prevention.
Instead, when the money is spent, we found it sometimes goes to what some experts call frivolous expenses, like a soft-serve ice cream machine and antique popcorn popper.
I don't want my mom to die from this virus.
Sissy Sanders' mother is in a nursing home that has seen at least 14 COVID-related deaths. She's asked federal and state government officials why they won't spend this money, but they won't give her any answers.
In the middle of a global pandemic and nursing homes being at ground zero for this particular virus, I believe there's no better use and no better time to use these civil money penalty funds than right now.
In September, the federal government decided nursing homes can receive up to $6,000 to pay for things that will help residents visit with family members, including tablets, tents, and plastic dividers.
They locked us out. And then every time we talked to her, we were lying to her, we're going to get to see you. It's not going to be long, and we knew it wasn't going to happen.
The pandemic has caused even more problems at nursing homes, problems that can't be solved with money. It's not easy lying to a 92-year-old mother with a smile like this.
It was just a constant bunch of lies to try and appease her because we didn't know what to do. We didn't know when it would be.
Betty Virginia Stark just wanted to see her two girls.
Girls, you never know how much I missed you and love to see both of you. Somehow, some way, we've got to get together. Share our love.
But her daughters had to lie about possible upcoming visits to her Missouri nursing home. The hope, try to keep Mom alive.
She wanted to go because she couldn't see her family. The 6 months was hell. She had no reason to live. It was devastating watching that.
Carla Helmig used to visit their mother 7 days a week, Jill Stark 3 or 4. Homes across the country shut off the outside world after COVID started spreading in the spring.
I know that my mother would have rather had visits with us and got it than to not had us for the last 6 months.
COVID is killing people in multiple ways. It's killing them as a virus, infecting them, but it's also killing them through social isolation.
In September, the federal government issued new guidance that helps determine when and if visitors should be allowed. Those rules include making sure there is adequate protective gear and staffing. But we found in mid-October, nearly 3,000 nursing homes reported they had a nursing aid shortage. More than 700 didn't have any N95 masks.
I think we have to be careful that we don't take the easy way out and just say, well, let's just not allow visitation. So allowing visitation means doing some work. It means making sure that the families and friends and visitors have masks, have personal protective equipment, are tested to make sure they don't have the virus. We can respect the dignity and the rights of the residents.
Nursing home executives call it a conflict, trying to keep COVID out of homes while trying to allow elderly residents to see their family.
I know it's been frustrating and I'm sure very hard on these residents. In fact, we've really got to protect their lives, and I think we need to err on that side.
For Carla and Jill, the easing of restrictions comes too late. On September 22nd, Betty Stark died of natural causes.
She would tell us forever that just seeing her kids was all she had. It's all she had to look forward to.
Two sisters hope their story will help force nursing homes and the federal government to do more and pull vulnerable residents like their mom out of isolation.
It's just total disrespect for our seniors.
The nursing homes where Betty Stark spent her final months did not comment for that story. Since our last story, many states have rewritten visitation orders to match the CDC's new guidelines that allow visitation in areas with low case rates and with certain provisions. The coronavirus pandemic has put a bright spotlight on nursing homes, exposing long-standing problems poised to continue without change. The stakes are high. These are our neighbors, our parents, and one day might be you. Now with this attention, there's a more aggressive push, a call for lawmakers to help vulnerable residents, hoping to create change, to make sure seniors aren't left helpless and at risk.
I do think the federal government needs to lead and give clear guidance. At the same time, the state governments, the county health departments, and then the nursing homes themselves have a responsibility. They cannot just be the landlords.
We actually need to rally around nursing homes. We need to provide them the testing and equipment and staff support that they need. We can change that. Governors can change that today.